Hi, good afternoon everybody. My name's Debbie Armstrong and I'm now
nice and close to that.
Oh, sorry.
That's it, yeah.
I'm now the Assistant Chief Nurse of Manchester University Foundation Trust.
And I'm Melanie McLean, Improving Quality Lead for the same trust.
So, who are we? Manchester University NHS Foundation Trust was only formed on the 1st of October in 2017, and that was following the merger of Central Manchester Foundation Trust and University Hospital of South Manchester of the first phase of the single hospital service in Manchester. As an organisation now, MFT has almost 20,000 staff, 9 hospitals across 6 sites, and we're serving a population of about 750,000 people. In terms of the organisation, the journey that we're going to talk to you about today has historically been a journey for CMFT prior to the merger, but that'll become clearer as we go through the presentation. So an important aspect of our journey has been the trust investing from the Board of Directors in the Quality Improvement Programme. The premise that frontline nursing and midwifery staff equipped with quality improvement expertise are empowered to lead continuous improvement influenced the decision for a massive investment in an entire quality improvement team. The organisation could see the potential that building capacity across the organisation would enable staff to drive change and embed a culture of continuous improvement. Since the development of the Iqp team and the Iqp Program, nurses and midwives in our organisation have been trained in Iqp methodology in order to equip them with the knowledge and skills to complete bottom-up improvement for continuous improvement. We recognised that it was about providing a climate to create a culture of continuous improvement. Over time, there's been a cultural shift from a position of staff with little or no improvement knowledge and no quality improvement programmes in place to a position of knowledgeable staff with teams who understand and are empowered to make improvements in their clinical area as everyday practice. The culture of continuous improvement journey through our Iqp programme has strengthened the foundation in which the organisation could build its quality improvement programme. And I'll hand over to Melanie now to discuss the actual work programme.
Okay, thank you. Okay, thank you, Debbie. It's been an incredible learning journey because I've been lucky enough to be involved early on at the onset, so it's coming up for a decade now. But actually, we learned a lot along the way, and we just need to draw some influence back to when we did early productive ward days during 2007-2009, where we were able to be one of the trusts nationally to roll out productive ward. So the lessons learned there then really influenced what was in our Improving Quality programme, and that was about the key foundation standards that we were able to introduce. We also invested in that particular time as well around I suppose indicators, quality indicators, making sure that staff had access to performance information around their wards and departments. We heavily focused on getting some real-time patient feedback for the group, so they could use that information to drive improvement. And it's that's helped them, and obviously giving them permission to go ahead and change has been the thing that's helped it along the way. Excuse my notes. I think as well as a quality improvement team, by developing an in-house quality improvement programme, we have not reinvented the wheel, but we've tried to make things simple for staff, less jargon, more doing. But what the big premise for those staff is that if they measure their journeys before, during and after a change, they'll be able to evidence that improvement and impact on their patient experience and data. Okay, so the Improving Quality programme was designed by the Quality Improvement team in partnership with the Chief Nurse and the Corporate Senior Nursing team to meet the needs of the organisation. And again, like I said, by building on the work of Productive Ward, we rolled out some set standards as part of the continuous programme. Okay, next, I'm thinking this will work. Yes. Okay, so the Iqp programme is around a combination of masterclasses and action learning. And it was for frontline staff to support them in introducing core standards. And the core standards we started with included the Improving Quality Data Board, so all our department ward areas display data, and they're quite proud of their information. And we also introduced Patient Status at a Glance Board, which have now evolved to an electronic board now. And also we introduced shift handover, a standardised shift handover and a core huddle. And we also introduced a system of colour codes using 5S lean principles. But to determine whether the culture of continuous improvement was embedded, this is where we developed the assessment programme. So it involved at the time, after they introduced these standards, we assessed by the head of nursing and a member of the quality of nursing team for their area. We'd check how well they'd done. And if they had many measurable improvements in their data, then we could obviously give them a real good reward. And then this was assessed and tested, and then that built into the foundation of a trust accreditation scheme. Okay, thank you. Okay, so staff absolutely love it. Staff can't get enough of IQP. So as Debbie was saying, there's been a cultural shift from having no improvement capability at the beginning of the journey to absolutely everybody wanting to be part of this. Any new starters, anybody that comes on part of the trust induction programme want to know about the IQP and make sure their staff have got those skills. And the demand to access IQP training has really increased. And so we talk to our staff all the time about what matters to them, and they all tell us that they're incredibly proud of their own particular journeys and are able to shine, and are ready for anybody to come on an accreditation, or be ready for anybody to come and come and visit their ward from external people. And also actually, just thinking about the CQC visit in 2016, they're actually used to people coming to visit their wards. So, they actually celebrated that. Okay, so I'm talking about nearly 10 years since the introduction of the programme. Teams are now skilled in using the IQP methodology, and they're expected to display their improvement work on boards. And they also keep a portfolio of evidence throughout the year, and that can then track where they're at. And they become improvement champions and become expert in their areas. And they also test their continuous improvement journeys as part of the accreditation scheme. And the accreditation scheme that we've introduced has absolutely driven and embedded a culture of continuous improvement, and teams now perceive IQP as part of every day. And the accreditation process is open and transparent, and it's celebratory, and rewarded with the toppest accolade would be a gold award. Okay. The accreditation scheme has now become well embedded and from Water Board, and wards achieve the highest accolade of the gold status. And accreditations are led by the chief nurse, deputy chief nurse, directors and deputy directors of nursing, head of nursing and midwifery, members of the quality improvement team, which ensures senior level engagement. We also involve currently the wider multidisciplinary team as experts on those groups. IQP and accreditations featuring our trust induction programme and also our newly appointed consultants programmes, and accreditation results are reported in our quality accounts, trust board and clinical commissioning group reports. So teams are really proud. I can't kind of say much, but I think we've had a really good response from our posters outside. But what I do want to share with you, because I know it's only 10 minutes, is that this is the length and breadth of our results. And you can see over the years we've increased the number of goals that we've achieved. But not only that, we've increased the number of areas that we've spread through. So when we started in 2011, we had around 50 wards. Then we moved, as we went through the years, in this final year now, we've introduced it and widespread it in far more areas, which include theatres, outpatients, community and the like. So, we're very proud of that achievement. Okay, and there obviously is a clear plan in place to help and support areas that achieve gold to get from good to great. I'm going to hand over to Debbie for the next steps.
So just very briefly, Melanie just alluded to the fact over the last sort of 12 to 18 months, we've recognised that the accreditation was an excellent assessment. But that actually we needed it for bespoke areas, so we've developed the accreditation for theatres, outpatients, our emergency departments and our community services, so we have a different style of accreditation for all of those areas. I think that's been key, and in response to staff feedback. I think finally, as a newly merged organisation, our challenge now is that both previous organisations had similar accreditation systems, and it's about now developing an accreditation system and an Iqp program that is fit for the newly merged organisation. And we believe that we'll be undertaking over 160 accreditations this year. So thank you. Any questions?
Fantastic.